Statistics show that adenoma of the prostate gland, prostate, occurs in more than a third of men older than 50 years. The prostate gland is a small organ, the size of a walnut, which is found exclusively in men. With age, hyperplasia can develop in this organ. This is a completely benign formation that tends to increase. Many factors contribute to the development of the disease, including inflammatory processes, hormonal disorders, and concomitant chronic diseases. The prostate gland in men grows and develops until the age of 25. The normal size of the prostate gland in men is about 25 cc, and the weight is about 20 grams, until the age of 40. Its size remains unchanged, but after that the growth process resumes. This is due to a change in the balance of hormones in the body as a result of its natural aging. Whether or not benign prostatic hyperplasia will develop against the background of these changes depends on many factors. Studies show a certain relationship between the development of a benign tumor in the gland and low sexual activity, a sedentary lifestyle, the presence of bad habits, liver and heart diseases, diabetes, and high blood pressure. The main symptoms of prostate adenoma are expressed in problems with the urinary system. A compressed urinary tract provokes difficulties with emptying the bladder, painful sensations and a distending sensation in the lower abdomen. And stagnant urine is an excellent environment for the development of inflammation, which in the future can affect all parts of the urinary system, including the kidneys. Signs of adenoma will help you recognize the disease in time. The stream of urine suddenly became weaker. You need to strain more during urination. False calls to the toilet are observed. A burning sensation is felt in the urethra. After going to the toilet there is a feeling that the bladder is not completely emptied. Urine of a cloudy color, sometimes with splashes of blood. Change in the usual frequency of trips, in a small way, too often or vice versa, much less often than usual. Today, a timely detected tumor is successfully treated without surgical intervention, using safe and painless methods. Diagnosis begins with collecting the most complete anamnesis. It is important for the urologist to study the patient's medical history. When the disease began to appear, which symptoms bother you, whether any conservative therapy was previously carried out. Additional tests may be needed to make an accurate diagnosis. Treatment of prostate adenoma is aimed at improving the patient's quality of life. If the symptoms are mild, the doctor may decide to monitor your condition with mandatory lifestyle changes. At the initial stage, only drug therapy can be used. The course of treatment for prostate adenoma includes antibacterial drugs, immunomodulators, and alpha blockers. Shock wave therapy also gives good results. Doctors recommend that every man after the age of 50 be tested for prostate-specific antigen on a regular basis. An elevated level of this protein indicates the presence of a tumor in the prostate gland. General preventive measures include moderate physical activity, giving up bad habits, proper nutrition, timely elimination of constipation and inflammatory diseases of the urinary system, limited use of water and other liquids at night, annual examinations by specialists.